Good afternoon, everyone. Welcome to the Assembly Committee on Ways and Means. Mr. Secretary, will you please call the roll? Oh, I'm sorry. Okay, let's try that again. Good afternoon, everyone. Welcome to the Assembly Committee on Commerce and Labor. Mr. Secretary, will you please call the roll?
Assemblywoman Carlton, Assemblywoman Considine, Assemblywoman Dickman, Assemblywoman Duran, Assemblyman Flores, Assemblyman Frierson, Assemblywoman Hardy, Assemblywoman Kasama, Assemblywoman Martinez, Assemblywoman Marzola, Assemblyman O'Neill, Assemblywoman Tolles, Chair Howdigi.
Here, thank you. Members, a few housekeeping items before we get started. I would remind everyone on the committee and those here in the audience to please silence all electronic devices. For those who are here and those who are listening online, please remember that all amendments, written testimony must be submitted to the committee manager by noon on the day prior to the committee meeting. For those who are joining us on Zoom, please remember to keep yourself muted at all times, but if you would, please keep your video on. That is the only way we know you are with us and the only way we can see you. I would also like to remind everyone that members will be using their laptops to view exhibits and amendments and bills. It is not a sign of inattention. With that, we do have a work session today and bill hearing. We will get started with our work session. Members, you should have the work session documents with you. I will like to note that we will be pulling Senate Bill 245 from today's work session, which will leave us with 3 items on work session. With that, we can go ahead and go into our work session, and I will hand it over to our policy analyst, Ms. Marjorie Pasloff-Thomas, to move forward with Senate Bill 122.
Thank you, Madam Chair. Assembly Bill 122 requires certain health and safety training for employees of cannabis establishments. It is sponsored by Senator Brooks, heard on April 28th, and there are no proposed amendments.
Thank you, Ms. Pasloff-Thomas. Members, any discussion on the bill before you? Okay, seeing none, I would entertain yes, Mr. Assemblymember O'Neill.
Thank you, Chair. I apologize for not raising my hand far enough. I just wanted to comment that I'll be voting no on this bill. I'm just not there yet. I want to talk to a couple people some more. So although I'll be a no here, I'll reserve my right to change over on floor if I can get to fully comprehend some parts. All right. Thank you, Chair.
Thank you, Assemblymember O'Neill. Assemblymember Dickman?
Thank you, Chair. I just say ditto to that.
Okay, members, any other discussion on the bill before you? Okay, seeing none, I would entertain a motion to do pass.
So moved, Madam Chair.
Thank you. I have a first by Vice Chair Carlton and a second by Speaker Frierson. Any discussion on the motion? Okay, all those in favor signify by saying aye. Aye. Opposed? I have 2 in opposition. I have Assemblymember O'Neill and Assemblymember Dickman. Anyone else? Okay, motion carries. I will assign that floor statement to Assemblymember Considine. Okay, the next item for work session is Senate Bill 248. Ms. Pasloff-Thomas?
Thank you, Madam Chair. Senate Bill 248 revises provisions relating to the collection of medical debt. It is sponsored by Senator John Darrell Loop, and it was heard on April 23rd. There are 3 proposed amendments. Half of them were kind of discussed during the hearing, and the second half were provided afterwards. So the first is to amend the definition of medical debt in Section 2 of the bill to exclude certain extensions of credit owed to a third party unless the credit was extended solely to purchase medical goods or services. The second proposed amendment amends Section 7 of the bill to require a collection agency to at least 60 days before taking any action to collect a medical debt, send written notice to the medical debtor by certified mail, identifying the name of the collection agency and informing the medical debtor it has been assigned or obtained the medical debt. 2B is to require the written notice sent to a medical debtor to include the principal amount of the debt. 2C is to specify that the 60-day period before action may be taken to collect a medical debt does not prohibit a collection agency from accepting voluntary and debtor-initiated payments, set forth certain requirements relating to such voluntary and debtor-initiated payments, and prohibit the waiver of the requirements of the bill. 2D deletes subsections 1C, 1D, and 2 of that section. The third proposed amendment amends Section 8 of the bill to clarify that the prohibition of the commencement of a civil action to collect a medical debt specified in subsection 2 does not prohibit the commencement of a small claims action to collect such a medical debt. Thank you.
Thank you, Ms. Pasloff-Thomas. Members, any discussion on the bill and the amendment before you? Vice Chair Carlton?
And thank you, Madam Chair. And I'm just trying to track the amendment with my notes, and there was a couple of moving pieces in this. So all of these amendments I have written off as being discussed in the committee members. Was there one that came in afterwards? And if we could elaborate on that, please.
That is the second amendment behind the sheet. So it's dated May 6th, and it was submitted by Bailey Bertolin, and it addresses Section 7 and 8 and made some additional changes based on the feedback that was discussed during the committee hearing. It looks similar to the other one. Do you have the attachments to the work session document? So it would be page 2 and 3, or page 2 of the attachments.
Thank you. Members, any other questions on the bill or amendment before you? Okay, seeing none, I would look for a motion to amend and do pass.
So moved, Madam Chair. Thank you.
I have a first by Vice Chair Carlton and a second by Assemblymember Considine. Any discussion on the motion? Okay, Assemblymember Tolles.
I just want to say thank you to the sponsors for continuing to work on this. I know there's some concerns about impact on smaller medical facilities, but I really appreciate the follow-up with the answers and the responses to it. And I do believe that it is important to keep these predatory practices from continuing and protecting these individuals from these cycles that can really dig them into a hole. So I will be supporting. Thank you.
Thank you, Assemblymember. Members, any other discussion? Okay, seeing none, all those in favor signify by saying aye. Aye. Opposed? Those opposed, would you please raise your hands? I have Assemblymember Dickman in opposition. Motion carries. I will assign that floor statement to Assemblymember Martinez. Okay, our next item on work session is Senate Bill 260, the first reprint. Ms. Pasloff-Thomas?
Thank you, Madam Chair. Senate Bill 260 revises provisions relating to internet privacy. It is sponsored by Senator Cannizzaro, and it was heard on April 30th. There are 4 proposed amendments which are contained in the mock-up that was prepared by the Legal Division. Originally, there was 2 sets of amendments, but this mock-up kind of combines everything together. So the first is to amend the definition of data broker in Section 2 of the bill. The second would be to revise provisions concerning the enforcement of the requirements imposed on operators and data brokers regarding the collection and sale of covered information for the purpose of authorizing any operator or data broker who has not previously been found to have failed to comply with such requirements to remedy any failure to comply within 30 days after being informed of the failure. If such an operator or data broker remedies such a failure, the operator or data broker does not commit a violation for the purposes of provisions governing the enforcement of the requirements by the Attorney General. The third proposed amendment would be to amend subsection 1 of section 1.5 of the bill to clarify that the exemption specified in that subsection applies to any consumer reporting agency as defined in 15 U.S.C. section 1681A(f) and any personally identifiable information regulated by the Federal Fair Credit Reporting Act and the regulations adopted pursuant thereto, which is collected, maintained, or sold as provided in the Act. The fourth proposed amendment is to delete subsection 2B of section 7.5 of this bill and amend the exemption provided in section 1.5 bill to include a financial institution or an affiliate of a financial institution or any personally identifiable information regulated by the federal Graham-Leach-Bailey Act and the regulations adopted pursuant thereto that is collected, maintained, or sold as provided in the act. Thank you.
Thank you, Ms. Pasloff-Thomas. Members, any discussion on the bill or amendment before you? Okay, seeing none, I would look for a motion to amend and do pass.
I would move amend and do pass, Madam Chair.
I have a first by Vice Chair Carlton, a second by Assemblymember Marzola. Any discussion on the motion? All those in favor, please signify by saying aye. Aye. Opposed? Okay, seeing none, motion carries. I will assign that floor statement to Assemblymember Flores. Okay, members, that completes our work session for today's afternoon. We will now go ahead and move into our bill hearing portion of the agenda. For those who are listening, I will be taking the bills out of order. I will be starting with Assembly Bill 190, followed by Assembly Bill 186, and last, I'm sorry, I said Assembly Bill. We will start with Senate Bill 190, followed by Senate Bill 186, and then Senate Bill 307. With that, I see our bill sponsor here, so I will open the hearing on Senate Bill 190, which provides for the dispensing of self-administered hormonal contraceptives. Welcome, Majority Leader Cannizzaro.
Thank you, Madam Chair, and members of the committee for having me here today. Again, my name is Nicole Cannizzaro, and I represent Senate District 6, which is located in the northwest portion of the Las Vegas Valley. And I'm here to present to you Senate Bill 190, which will allow women to access birth control in the state of Nevada without a prior prescription from their doctor and while being covered by insurance. Madam Chair and members of the committee, I do have with me as well, available via Zoom, Dr. Sandy Koch, who will be able to provide a little bit of context, but I would like to provide just a few comments regarding the bill to the committee first. Birth control is essential health care. And Senate Bill 190 will work to eliminate more barriers to access in Nevada and to level the playing field for women. Some women may have to wait months before they can get an appointment with their OB/GYN in order to get a prescription for birth control. Other women may lack regular access to transportation to go to and from doctor's appointments, limiting their ability to obtain a prescription. And for many Nevada women, the barrier lies in juggling multiple roles, including providing care for family members, working, and assisting with their kids' education. None of these reasons, however, should mean that women have to forego caring for their own health and well-being due to lack of access to contraceptives. Studies show that 99% of sexually active women have used a form of birth control at some point in their life. And we do so for varying reasons, whether it be to finish our education, to obtain a career goal, or simply wait to have a family for when we are ready to do so. Birth control empowers women to make decisions that are right for their own bodies. And medical research supports this too. From treating acne to ovarian cysts, birth control has been prescribed to millions of women to benefit our health. And over the course of decades, research compiled shows that access to birth control has a direct link to reduced infant and maternal mortalities. This is part of the reason why the American College of Obstetricians and Gynecologists supports allowing pharmacists to dispense contraceptives in order to increase access, and this is also why I'm here to present to you Senate Bill 190 today. As anybody who has tried to make an appointment with their OB/GYN, you know how hard it can be to not only get those appointments, but also should you have to change them to try to get yet another date, sometime close to that date, in order to get in to see a doctor. And for anybody who has used hormonal contraceptives before, we also know that for the most part they are very safe and very easy to use, and oftentimes just requires the simple renewal of a prescription that that woman has been taking for years and years. I think that by reducing the barriers and providing more access to these in a way that we know can be safe for women is a way that we can actually increase access to healthcare in general. This bill that you see before you is the result of hours of conversations with medical experts from across the state and country. One of those experts, as I mentioned, is Dr. Sandra Koch, an obstetrician with over 30 years of medical experience. She is here with us today, and before I walk through just the basic tenets of the bill, Madam Chair, I would like to ask if she could provide some testimony on the importance of pharmacist-provided hormonal birth control. And I believe we have her available via Zoom.
Dr. Koch, if you would just unmute yourself and we're ready for you. Dr. Koch, we cannot hear you. Would you make sure that you are unmuted? Okay, I'm going to ask our broadcasting department if they could step in. I know we've had this happen a couple of other committee meetings, and they've been able to fix the problem. Broadcasting, could you help Ms. Koch with her audio? Broadcasting, are you with us? Broadcasting?
Hello.
Oh.
Chair, this is Michael from Broadcast. Can you hear me?
We can hear you now. Yes.
Okay, perfect. Dr. Koch, go ahead and try again. Let's make sure this is working.
Okay, thank you. Hi, I'm Dr. Sandy Koch, and I am here in support of SB 190 because birth control is an essential component of women's health care. And this bill will increase affordable. Can you hear me?
Yes, we can hear you, Dr. Koch.
Oh, this bill will increase affordable, reliable access to self-administered contraception. The American College of OBGYN actually started to advocate for over-the-counter access to contraception almost 10 years ago. The FDA's assessment of safety for oral contraceptives have shown no significant toxicity, and multiple studies have shown the screening tool is highly successful in identifying the small number who should not use the over-the-counter contraceptives that contain estrogen. Unfortunately, the current U.S. law requires patients to have an appointment with a healthcare provider to start or continue contraceptives. A nationally representative sample of 30% of women who tried to obtain a prescription for a hormonal contraceptive reported difficulties obtaining the prescription or refills. A variety of factors contribute to this, but lead to gaps in care, early discontinuation, and put women at risk for unintended pregnancy. The FDA has not yet approved any hormonal contraceptives for over-the-counter use, but allowing pharmacists to dispense these contraceptives with the assistance of a self-administered screening tool is a step in the direction of making contraceptives more available to women. Some people have expressed a concern that women may not get recommended preventative care if they do not see a provider to obtain hormonal contraception. Studies have shown that women who can access contraceptives without a prescription have similar rates of receiving preventative health care as with women who have to have a prescription in order to obtain contraceptives. Although OBGYNs still recommend that women see their doctors regularly, we don't believe that delaying or missing an appointment should be a reason for women to be denied contraception. So we actively support this bill, and we hope that you all will too, and I'm available for questions if needed be. Thank you so much for the opportunity.
Thank you so much for your testimony, Dr. Koch. Majority Leader?
Thank you, Madam Chair, and thank you, Dr. Koch. So what Senate Bill 190 does is puts in place a practice protocol that will allow for pharmacists to dispense birth control to women in Nevada. Currently, 13 states in the District of Columbia have similar laws allowing pharmacists to provide birth control without a prior prescription, whether through a standing order, practice protocols, or by expanding their scope of practice. I would note, Madam Chair, that we did submit a proposed mock-up to Senate Bill 190. It is proposed Amendment 3365, which I believe should have been provided to the committee, and so I'll be basing my comments off of that. And what that amendment essentially is doing is allowing for this to be a practice protocol rather than a standing order by the chief medical officer, which was done with consultation of DHHS. This is currently how we are asking to do a number of other things in not only this legislative session, but is sort of the preferred method for allowing for pharmacists to have that ability, in particular because of concerns over making sure that there is appropriate liability and responsibility with respect to that. So briefly, I want to talk about a few sections of the bill. First, Section 8.5 authorizes a pharmacist to dispense hormonal contraceptives in conjunction with that practice protocol that will be set up in conjunction with the board. Section 2.5 requires the Board of Pharmacy to adopt regulations to establish a practice protocol for dispensing self-administered hormonal contraceptives. And Sections 2.5 and Section 3 require that a risk assessment questionnaire, which Dr. Koch also spoke about, must be administered to a patient who requests a self-administered hormonal contraceptive, and it includes the information that must be provided in writing to those patients. Going back to Section 3, this section authorizes a pharmacist to dispense a self-administered hormonal contraceptive under the practice protocol, regardless of whether the patient has obtained a prescription from a practitioner. Before a pharmacist may dispense a contraceptive, they must provide the risk assessment questionnaire, and if the results of that questionnaire indicate that it is unsafe to dispense the self-administered hormonal contraceptive, then a pharmacist may not dispense the contraceptive to the patient and must refer the patient to their healthcare provider. Additionally, pharmacists must create and maintain a record of each person to whom a self-administered hormonal contraceptive is dispensed, including the name, drug dispense, and other relevant information required by the protocol. Pharmacists must also inform patients of proper administration and storage of the contraceptive, potential side effects, and the need to use other methods of contraceptive if appropriate. Certain written records related to the request or dispensing of self-administered contraceptives must also be provided to patients, regardless of whether a contraceptive is dispensed. Sections 5 and 6 amend the scope of practice of a pharmacy to include dispensing self-administered hormonal contraceptives and authorize the State Board of Pharmacy to suspend or revoke a certificate to practice as a registered pharmacist if the pharmacist dispenses such contraceptives without complying with the provisions of the bill. And finally, Section 7 and Sections 9 through 15 require certain health insurers, including Medicaid and state and local governmental employer-based plans, among others, to cover self-administered hormonal contraceptives dispensed by a pharmacist. Chair Hadegay, this concludes my explanation of Senate Bill 190, which will allow women to have easier access to birth control. And I do urge the committee's support, but I am happy to answer any questions that the committee may have. And I know that Dr. Cook was also available, but may need to leave as she is currently in practice as well. So we're happy to answer any questions that the committee may have.
Okay, thank you. Thank you for your presentation, Majority Leader. Members, questions? I will start with Assemblymember Kasama.
Thank you, Assemblywoman Kasama, District 2. For the record, thank you, Senator, for bringing this bill forward. I read through the bill, and I was just curious, was there any, I didn't see it, is there any age limit in here, any restriction on age limit? I may have missed that.
Thank you for the question, Assemblywoman. Nicole Cannizzaro, Senate District 6, through you, Madam Chair, to the Assemblywoman. And there is not explicit language in the bill that has a direct age limit, and I don't know if Dr. Koch had some additional information or comments that she could provide in that context as well.
The American College of OBGYN and the American Medical Association recommend that this not include an age limit. We use birth control pills for girls starting as young as their menstrual periods do. And so I would not want to restrict this to an age that, to an age, a later age. I think that would be harmful to the bill and to Nevadans.
And that was Dr. Sandy Koch for the record. Dr. Koch, if you would just introduce yourself before answering any questions, and Majority Leader, you can go directly to the members. Okay. Members, any other questions? Assemblymember Dickman.
Thank you, Chair. And I was just wondering, since there is no age restriction, is there any parental consent involved with minors?
And Dr. Koch, if you wanted to take that question.
Yes, I just wanted to say that currently in the state of Nevada, girls at any age can obtain birth control through the public health department, and there is no parental consent required in the state of Nevada.
Okay.
Thank you.
I'm going to go to Vice Chair Carlton next.
And thank you, Madam Chair. So I guess my caution in this bill, and I understand, Senator, where you're trying to get, but without the yearly exam, and at that time it was 3 years, the cancer that I suffered from would not have been caught. We know what busy moms are like. We know what busy young women are like. If they put off getting that exam every 2, 3, 4, 5 years, I just have an apprehension that we know what it's like. We don't go unless we have to, because we take care of everybody else in our families before we take care of ourselves. So I'm just concerned that something might not get found if there isn't some exam somewhere along the way. If it's just open-ended, how do we, and I know we can remind them and we can put up signs, but you're really inspired to go to the doctor when you know that pill prescription's going to be up. And you make that appointment when you can. So that's my concern.
Thank you, Assemblywoman Nicole Cannizzaro, Senate District 6. Definitely, Madam Vice Chair, that is something that has been a question on this bill. And I think you've I think, outlined something that is a significant concern. At the same time, women who are hesitant about going to the doctor to get a prescription are likely to go without that prescription, and some may schedule that appointment in order to go to get the prescription. But there are so many more that just aren't going to, and are going to resort to other methods, or simply, not take that precaution, and we end up with other, I think, long-term issues with infant and maternal mortalities, with children who are not being properly supported because it wasn't necessarily where that mom wanted to go. Certainly nothing in the bill is meant to take away from the fact that we go to the OBGYN for any number of reasons, not the least of which is having a prescription for birth control. We should still be going for pap smears. We should still be going for other checkups. When there are other issues that arise, we are still going to the doctor. Similarly, if we get a cold and need to take Theraflu or need to take some sort of over-the-counter medicine that we may get from the Walgreens, or if we ask for the pharmacist to prescribe something, that doesn't necessarily mean that we don't go to the doctor if there's something else that's going on, or we want to go in for a checkup to get regular blood work done. And so I think part of this is encouraging women to continue to do that, because it is such a huge piece of our health. And so I think that is really the point here. I also know that Dr. Koch, and I don't know if she would want to explain more, but where we have seen this before, there's not a decrease in women actually accessing those important parts of healthcare to get checked regularly for cancer screenings and for other issues that come up that we may see an OBGYN for, even though we're allowing for easier dispensing of hormonal contraceptives.
Thank you. And Dr. Koch?
Hi, Dr. Sandra Koch for the record. I just wanted to add that what we don't want to do is be in a position where we're trying to coerce women into getting health care. And I think, holding contraception hostage, their access to contraception hostage, because they cannot access or do not access health care, is probably not the right approach. the study was done where they looked at women in Mexico where it's not required to get a contraception, a prescription for contraceptive, and comparing the use of screening methods for various healthcare needs. And there was no difference between the women in Texas and the women in Mexico when you compared their access to preventative healthcare services. But I do think it's really important to recognize that the coercion is the wrong approach here. It's really important for us to allow women to control their fertility and access contraceptive methods that are helping them with other medical problems without requiring them to see a healthcare provider. We want to encourage that, but not require it. Thank you so much.
And thank you, doctor. I appreciate that. I think the term hostage is a little strong, but inspiring women to keep up with it, as I said earlier, we tend to put ourselves last. And sometimes it takes a little motivation to get us to take care of ourselves. So thank you.
Okay, my next question is from Assemblymember Hardy.
Thank you, Chair, and thank you, Senator, for bringing this bill. And I too share some of the same concerns I'm sure you heard as Assemblywoman Carlton. Sometimes, especially with younger women, they think that, oh, I'm young, nothing can affect me, and sometimes abnormalities and things are caught only by going in and, needing a prescription or something like that. And so, I do have that concern as well, but, I also think this can be beneficial. So I just have a couple of questions. So as far as, someone would go in, fill out a questionnaire, and then it says here, if it's unsafe to dispense, then the pharmacist would refer them to their attending provider. So are they required, let's say there isn't anything, it's not unsafe, are they still required to let the provider know that this person came in and got the prescription?
Thank you for the question. Nicole Canizaro, Senate District 6. Assemblywoman, no. The way that the bill is structured is that they would provide the questionnaire to any woman who's coming in to ask for the self-administered hormonal contraceptive. Based on that questionnaire, which has been highly effective in recognizing the same things that your particular practitioner would recognize if you went in and said, hey, I would like to have a prescription for hormonal contraceptive. Some medical conditions that you have, some other medications that you may be on, or your history may dictate that certain hormonal contraceptives are not appropriate for you to take, and it would be best to go to a practitioner to have a further evaluation and then make a decision about what sorts of contraceptive care would be safe for you to have. But it doesn't require for then the pharmacist to contact that person's healthcare provider to say, by the way, we issued this prescription. Obviously, that's part of the patient's records, and there would be, as part of the bill, regulations that would be adopted for the practice protocol that would prescribe some of those things so that there would be a record of what had been administered. But the point of the questionnaire is to identify any of the same things that a practitioner would be looking for that might say, hey, this hormonal contraceptive is not appropriate. I would also note that we are talking about the self-administered contraceptives. And so there are some contraceptive pieces like an IUD or something like that that you would still have to go to a healthcare practitioner for those kinds of things. So this is, when you're talking about this, for the most part, these are things that someone can administer themselves, and we kind of know what those risks are, and that's what the questionnaire would be based on, and again, has been highly effective in being able to diagnose some of those items.
Follow up?
Okay, thank you for the further explanation. So what if, let's say they get one prescription and then for whatever reason they have some side effects, would that person then be able to go back to the pharmacist and discuss that and try something else?
Thank you for the question. Nicole Canizaro, Senate District 6. Assemblywoman, yes, they would be able to go back to the pharmacist. Obviously, that may trigger the pharmacist to say, hey, according to this questionnaire, you've had some issues with hormonal contraceptive, we'd refer you to a healthcare provider for a further follow-up. Most women who get hormonal contraceptive care of the sort that we're asking for pharmacists to have the ability to dispense get that from their practitioner and have no side effects and no issues, and are able to keep that prescription for years and years. And every year, they go in, or every however many years, 3 years, and go in and get the prescription just filled by their doctor. And they go down and pick up the prescription, and that's it. And so for most women, that questionnaire is going to be able to delineate what those issues may be. But where there are further issues, they would go to a healthcare provider to get some additional follow-up and find out what exactly the problem may be. But they could go back to the pharmacist and say, you know what, this one isn't really working. Is there something else based upon this questionnaire that might be a little more effective for me? And I can think of different circumstances where that's come up, where, sometimes you may gain more weight with a certain contraceptive than another, or, it may exacerbate things like acne or other, responses. And so you might not want that particular brand, and they could certainly go to the pharmacist to adjust that. But I think in all cases where there may be complications, we'd want them to see a healthcare provider.
Okay, thank you.
Members, Assemblymember O'Neill.
Thank you, Chair. Thank you, Senator, for this bill. And anything Dr. Koch says carries a lot of weight with me, so I am supportive. But I do have a question for you. Since we're talking in some groups, since there's no age limit, maybe 15, 16-year-old girl goes in, fills out the questionnaire, which the pharmacist then says, you should not, you may have some health issues, you should go see your doctor before that, before I can issue it to you. So the young lady says, she goes down the street to the next pharmacy, knows how to fill out the questionnaire now a little better with, she wants the pills, maybe for whatever reason. Is there any protection, indemnification given to the pharmacist for giving her the prescription when the material's been either falsified or maybe not with full knowledge? I'm looking for some kind of protection for the pharmacist.
Sure, and thank you for that question. Nicole Canizaro, Senate District 6. So there isn't anything specific in the bill that delineates some of those items if somebody were to go in and falsify documents. Obviously, we have a whole host of state laws and other ordinances and regulations and other items that pharmacists would have to abide by, right, in order to do their job and make sure that we're not accepting falsified documents. And when that happens, that there are consequences to that. I think, if Dr. Koch wanted to weigh in on any of it, I would venture to say it's probably going to be very difficult for someone to go in and say, okay, well, it was this particular thing and this particular thing, and so I'm going to change it. And if that's the case, I mean, they could always have gone from one provider to another provider under the laws that exist now, right, and give different answers to questions in order to get contraceptive care. Certainly, I think there is some ability for the State Board of Pharmacy to adopt regulations in accordance with the practice protocol to put into place anything that may address some of those issues. I would venture to guess that is probably a pretty uncommon and would be very rare, if at all, that someone would be going from one to another if they couldn't go to a healthcare provider. And in addition, as Dr. Koch mentioned, they could just go to the state health department and obtain, the same thing, or go and see a provider as well to obtain contraceptive care if there was some issue with the questionnaire.
I appreciate that. Thank you, Chair, for the time.
Members, any other questions? Okay, Majority Leader, I just have one, and it's just out of curiosity, clear, and I think I know what direction you were going in, but I'd just like it for the record. The amendment changed the regulations from the chief medical officer to under jurisdiction of the board. Could you just explain to me why?
Yes, thank you for the question, Chair. Nicole Canizaro, Senate District 6. So we originally had this as a standing order from the chief medical officer. The chief medical officer in the state is not a physician who is licensed in the state of Nevada, and so there were some concerns, and in consultation with the Department of Health and Human Services, some concerns about where liability may exist, and so one of the preferred methods to do this was to create that practice protocol, and that's what's delineated in the amendment. We are currently doing this for a few other over-the-counter items, and there are a couple of bills currently that are actually pending that have the same sort of protocol and procedure, because the State Board of Pharmacy can regulate the pharmacists. It allows for a little bit of a clearer picture for any liability that may result, and was definitely the preferred, one of the preferred paths with respect to DHHS, and so that's why we did that.
Okay, and seeing no further questions from members, I'm going to move us into testimony. Because we do have a pretty lengthy agenda today, I will be taking 20 minutes of support, opposition, and neutral. 20 minutes each. 20 minutes for support, 20 minutes for opposition, and 20 minutes for neutral for all three of the bills today, just to keep us on track and so we don't lose members to the afternoon committee. Members, I also do want to make note before we go into our testimony portion that we will be going back into a work session after the bill hearings on the bill, SB 245, that was on the work session at the beginning of the agenda. So with that, seeing no one here in Carson City to testify in support of Senate Bill 190. Is there anyone on Zoom? If you could turn on your camera and raise your hand. Okay, it looks like we do have someone. If you would just unmute yourself, and then if you would just please state your name and spell it for our committee secretary, and then begin your testimony.
Thank you very much, Chair and committee members. My name is Nick Shepak, Nickshepak, Policy and Program Associate with the ACLU of Nevada. We are here in strong support of SB 190. Removing barriers to access to birth control has broad positive impacts in economics, educational opportunities, racial justice, and other areas. Difficulty accessing birth control disproportionately affects women of color, and Black women are more than 3 times as likely to have physical conditions that are treated with hormonal birth control. Removing barriers to access in birth control can only benefit all communities. Further, multiple studies have shown that access to birth control is one of the most influential factors in enabling women to stay in college. It has been linked to a 20% increase in enrollment and a 35% decrease in dropout rates. The Bloomberg Business Week has listed contraceptives as one of the most transformational developments in the business sector in the last 85 years. It has helped narrow the wage gap between men and women as well. Removing barriers in access to birth control will increase access to education, jobs, and overall better health. We urge you to support this piece of legislation.
Thank you, Mr. Shepak. Is there anyone else on Zoom who would like to testify in support? Okay, if you would, it looks like I have you as Ms. Jerry Burton. Okay, if you would just please unmute yourself and begin.
Thank you. Good morning, Chair Hadagi and members of the Commerce and Labor Committee. For the record, my name is Jerry Burton, Jeri and then Burton. I'm the president of the Nevada chapter of the National Organization for Women. And I'm speaking in support of SB 190 representing our members. We feel it would authorize the pharmacist to dispense contraceptives over the counter, and it would make it more accessible for women in Nevada. I think we talked about it earlier, but there's 15 other U.S. jurisdictions who allow pharmacists to prescribe contraceptives around the United States. And in Oregon, they found that it helped women in rural areas with accessibility. And we know during the pandemic, women found access to their doctor difficult, and they still needed contraceptives. The pharmacists often have more convenient locations, extended hours for obviously women who are working, and that's something that physicians certainly lack. It's hard to make an appointment. And the cost of the appointment, taking time off for work for the doctor's appointment, we just really feel like this will help women in Nevada with access. So we ask you to support SB 190 to help the women in Nevada. Thank you.
Thank you, Ms. Burton, for your testimony. Is there anyone else on Zoom who would like to testify in support of Senate Bill 190? If you would just please turn on your camera and raise your hand. Okay, seeing none and seeing no one here in Carson City Broadcasting, can we please go to the telephone line?
To testify in support of Senate Bill 190, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 199, please slowly state and spell your name for the record. You may begin.
Thank you, Chair and members of the committee. My name is Tess Opperman, that's Opsferman, speaking on behalf of the Nevada Women's Lobby. First, I want to thank Senator Cannizzaro for her hard work on such important legislation. We echo what those before me have already said. SB 190 is critical to creating easy access to birth control, ensuring women are able to make decisions about their bodies and their futures. Allowing pharmacists to distribute birth control means women can easily access necessary preventative birth methods without a doctor's appointment and without insurance. This is a huge step in women's health, and we are in full support of this measure. We ask you to support this bill, and thank you for your time this afternoon.
Thank you for your testimony. Broadcasting, next caller, please.
Caller with the last 3 digits of 362, please slowly state and spell your name for the record. You'll have 2 minutes. You may begin.
Thank you, Madam Chair. For the record, my name is Katie Robbins, Katie Robbins, and I'm here on behalf of Planned Parenthood Votes Nevada in strong support of SB 190. SB 190 is a common sense policy that gives Nevadans more autonomy over their reproductive health by removing the barrier to having to see a doctor simply to access birth control. Allowing pharmacists to dispense birth control will have a positive impact on all people seeking hormonal birth control, and especially people of color and those in low-income communities who are disproportionately impacted by barriers to care. Increasing access to reproductive health care will improve the lives of Nevadans and make our state stronger and more equitable. We urge the committee's support of SB 190 and thank Senator Cannizzaro for bringing this important bill. Thank you.
Thank you for your testimony, Ms. Robbins. Broadcasting, next caller.
Please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Good afternoon, Chair Howdigi, members of the committee. For the record, my name is Serena Evans, Serena EVANS, and I'm the policy coordinator for the Nevada Coalition to End Domestic and Sexual Violence. Having easy and affordable access to birth control is important for everyone, especially for victims, survivors of domestic and sexual violence. Accessing healthcare is a challenge for many Nevadans, and for victim survivors who are constantly surveyed by their perpetrator, accessing a healthcare professional to get a prescription for birth control is not always feasible or safe. In some instances, perpetrators will accompany the victim survivor to every doctor appointment to assert power and control to sabotage their use of birth control. Being able to access birth control over the counter at a pharmacy may allow victim survivors the much-needed accessibility to be able to access birth control to prevent unwanted pregnancies with their perpetrator. Allowing people to access birth control from pharmacists directly will greatly decrease barriers for so many Nevadans and can have truly positive and important impacts for victim survivors of domestic and sexual violence. Thank you so much.
Thank you for your testimony. Broadcasting, next caller.
Caller with the last 3 digits of 729, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Hi, my name is Caroline Mello Robertson, for the record, CarolineMello I am the Southwest Regional Director for Mayoral Pro-Choice Nevada, and we are proud to testify in support of SB 190, Senator Cannizzaro's legislation to expand birth control by allowing pharmacists to dispense contraception to individuals without their doctor authorizing the standing order with the chief medical officer. Mayoral is a not-for-profit organization dedicated to advancing reproductive freedom for everybody through political, policy, and community organizing. Mayoral organizes through the state through things like virtual meetups, phone banks, online actions, and community events. We have more than 44,000 battle-born, feminist, strong members statewide and are growing every day. Contraception is an essential fact for tens of thousands of Nevadans. Indeed, according to the Guttmacher Institute, more than 99% of women aged 15 to 44 report using some form of contraception, with more than 60% currently using contraception. Most women, 72%, use a non-permanent method like the pill, the patch, or the ring. If SB 190 becomes law, Nevada would join 18 states that currently allow pharmacists to dispense self-administered birth control, medication that has proven to be safe and effective over decades of use without a prescription from the person's doctor. This increases options for Nevadans to access this essential care, something sorely needed, particularly for Nevadans living in rural areas. Seamless access to birth control supports individual health and economic well-being. Even before the global pandemic, it could be challenging for Nevadans to see a doctor and to obtain a prescription and then visit a pharmacy to pick up a prescribed contraception. Our current need for medical care continues to outpace the supply. Nevada ranks 45th for active physicians per 100,000 population, 48th for primary care physicians per 100,000 population. The global pandemic has only exacerbated this problem. Allowing pharmacists to dispense birth control pills to people without their doctor's prescription is only one way to alleviate this problem, allowing folks to get their contraceptives on time while not being an unnecessary burden on an already overcapacity system. For birth control to be effective, consistency and timing is essential. SB 190 makes critical steps towards breaking down barriers to contraception and ensuring we can all live in a more free Nevada that works for everybody. Nevadans are proud to live in a state with a long history of trusting women to make their own personal health care decisions. With this bill, the Silver State can live up to our values. We urge the members of this committee to vote in support. Thank you.
Thank you for your testimony. Broadcasting, next caller.
Caller with the last three digits of 681, please solely state and spell your name for the record. You'll have 2 minutes and may begin.
Good afternoon. My name is Vasudha Gupta, Vasudha, last name Gupta. I am an associate professor at Roseman University College of Pharmacy and a board-certified clinical pharmacist at a federally qualified health center in Henderson. I'm representing the Nevada Pharmacy Alliance, and we fully support Senate Bill 190. Nevada has a significant shortage of primary care providers, and this may be especially burdensome on patients living in rural areas and those in primary care deserts. 68% of women have reported difficulty in access to care. However, the majority of Americans, more than 90%, live within 5 miles of a pharmacy and are able to access those services. Pharmacists have a doctorate degree focused on medication management, are highly trained professionals, but unfortunately are underutilized. Pharmacists being able to prescribe safe and effective hormonal contraceptive medications will significantly improve access to care to women who want to prevent pregnancy, along with allowing pharmacists to have discussions with patients about safe sex practices. SB 190 will help reduce unintended pregnancies and decrease the burden on our healthcare system. I also briefly wanted to touch upon insurance coverage. There's so many times I've dealt with this personally as a patient and as a healthcare provider. With our healthcare system, insurance provider coverage changes constantly and medications are often not covered, which leads to a back and forth with the provider and the pharmacy trying to figure out which medication will be covered by the insurance. This could delay access by weeks for the patient and cause unnecessary burden to patients and providers. If the entire process is done at the pharmacy, it's easy for the pharmacist to determine which prescription will be covered, and it can be dispensed then and there for the patient. I thank you for the opportunity for speaking.
Thank you, Ms. Gupta. Broadcasting, next caller, please.
Caller with the last three digits of 528, please solely state and spell your name for the record. You will have 2 minutes and may begin.
Good afternoon, Madam Chair and members of the Assembly, Commerce, and Labor Committee. For the record, Liz McMenamin, LIZ-MACMENAMIN, with the Retail Association in Nevada. I'm happy and proud to come to the table to support Senator Canazaro's bill, SB 190, today. We truly believe that this is a timely and equitable access to hormonal contraceptives to women, and we believe that this will be a route for that for everyone. This also allows for the freedom of choice and removing barriers that may exist to obtaining hormonal contraceptives. I also wanted to state that pharmacists are capable and willing to provide this service for women in our state. And in talking towards Assemblywoman Carlton's concerns, I believe the pharmacist, who's very well trained, can and will provide the encouragement for these women that visit them to also obtain health care, obtain service from their healthcare providers. And with that, I'd just like to say that I appreciate the opportunity to speak to you today, but I also would appreciate this committee supporting Senator Canizaro's SB 190. Thank you very much.
Thank you for your testimony. Broadcasting, next caller.
Caller with the last three digits of 510, please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hi, my name is Courtney Joslin, Courtney Joslin, and I am a resident fellow for the R Street Institute, which is a nonprofit, nonpartisan public policy research organization. We engage in policy research that supports free markets and limited but effective government, and I lead R Street's research on state policies for birth control access, with a focus on sensible deregulatory efforts like pharmacist-prescribed birth control. I appreciate the opportunity to give some brief comments on this. So for over a decade, the pharmacy access model, as it's often called, has been studied for its safety and ability to increase birth control access. A 2008 study found that virtually everyone who received a pharmacist-initiated prescription reported that they were happy with the experience and would like to continue seeing a pharmacist for their prescription. Since that study, 18 states and Washington, D.C. have begun allowing pharmacists to prescribe hormonal birth control. And to date, over 3,300 pharmacies are now safely offering birth control consultations with the same basic protocols, such as a blood pressure test and the patient's self-reported medical history, in states across the country, including every state bordering Nevada. Women who see pharmacists for birth control are shown to be more likely to be uninsured and younger than women who see a doctor, which suggests that obtaining regular doctor's visits just to maintain their birth control prescription is too high a barrier for many. Further, as many have noted, many of the leading medical associations across the country have supported increased access to birth control by deregulating it. And this is due to birth control's time-tested safety and efficacy. Finally, the pharmacy access model saves taxpayer funds and reduces burdens on families. So currently, 52% of pregnancies in Nevada are unplanned, which is costly to families, taxpayers, and the government. For example, in 2010 alone, Nevada taxpayers shouldered over $37 million in unintended pregnancy-related costs under public health insurance programs, while the federal government spent over $65 million on these costs in Nevada. However, an Oregon-based study found that pharmacist-prescribed birth control led to a reduction in unintended pregnancies, as well as a $1.6 million savings to the state's Medicaid program within just the first 2 years of implementation. If Nevada implements a similar model, as this bill would do, it will see similar returns. In summary, the pharmacy access model is safe, effective, and supported by the national medical community and reduces burdens on all Nevadans. We support the passing of SB 90, and I thank you for the opportunity to elaborate.
Thank you so much for your testimony. Broadcasting, next caller.
Caller with the last three digits of 283, please slowly state and spell your name for the record. You'll have 2 minutes and may begin. Caller with the last three digits of 283, please press *6 to unmute.
Marcos Lopez, Americans for Prosperity Nevada, MARCOS, LOPEZ. A lot of previous callers made a lot of the same points that we were going to make. We believe this is a good, positive, free market reform to help increase healthcare access, and we are proud to support SB 190.
Thank you for your testimony. Broadcasting, next caller.
If you recently joined the call and would like to testify in support of Senate Bill 190, please press *9 to take your place in the queue. Caller with the last three digits of 898, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
For the record, my name is Annette Magnus, and I'm the Executive Director of Battleborn Progress. Thank you, Chair, and thank you, Senator Canizaro, for this important bill. I just wanted to testify, actually, from my own personal opinion on this bill and my organization. But recently, I had a situation where I couldn't get my birth control because my prescription ran out because I cycled my pills. And I was having issues accessing it because my doctor's appointment hadn't come up yet. So I see my doctor yearly because I too, like Assemblywoman Carlton, have medical issues that requires me to see a doctor yearly. But I cycle my pills for medical reasons because I get horrific migraines and I have to have the birth control to mitigate the hormonal swings that I would normally have. I recently ran out of that prescription because I take them more quickly and I don't go through my placebo pills. And when that happens, I'm not able to get into the doctor because I'm not scheduled for my annual exam until July. So if I would have been able to walk into my pharmacy and actually get my pills, I wouldn't have gone through an entire cycle without having my pills and getting a migraine and going through all of the hassle it becomes to get my pills. And so this is an important bill for women like me who use birth control not only for birth control, but also for medical reasons and need easy access for the pills and could have easily walked into a pharmacist and received those pills. So I want to thank the sponsor of this bill because for women like me, it's critical for our healthcare. Thank you.
Thank you for your testimony. We will take one more caller in support. Broadcasting, next caller.
Caller with the last three digits of 005. Please slowly state and spell your name for the record. You will have 2 minutes and may begin.
Hello, my name is Ken Kunke, Kenkunke, and today I'm here representing the Nevada Pharmacy Alliance. We are an organization that represents pharmacy professionals that work all over our state, and we are excited to expand our ability to take care of patients, and I'm here to show our support of Senate Bill 190. A lot of the points that I was going to make have already been made, so I'll just say ditto. The states that do have these protocols in place, they are showing that they're very effective and safe, and I know that our Board of Pharmacy can put those same precautions in place here in Nevada. So in that, I would ask you to support Senate Bill 190. Thank you.
Thank you so much for your testimony. Okay, at this time, we are going to go ahead and move into testimony in opposition of Senate Bill 190. Seeing no one here in Carson City, no one signed up on Zoom. Broadcasting, could we please go to the telephone lines?
To testify in opposition of Senate Bill 190, please press star 9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you, Broadcasting. And can we go straight into testimony in the neutral position on the telephone line?
To testify in the neutral position on Senate Bill 190, please press star 9 now to take your place in the queue. Caller with the last three digits of 918, please slowly state and spell your name for the record.
Hi, my name is Leanne McAllister, Leann, MC, capital ALLISTER. I am the Executive Director of the Nevada chapter of the American Academy of Pediatrics. Today, I offer neutral testimony on behalf of the Nevada AAP for SB 190. The Nevada AAP has no issue with pharmacists dispensing contraceptives, but it's important for young adults and adolescents seeking birth control in Nevada to know that the American Academy of Pediatrics recommends LARCs, long-acting reversible contraceptives, over short-acting contraceptives like the pill for patients. LARCs are highly effective, long-term, and have minimal side effects. LARCs are the most effective contraceptives to prevent pregnancy. But like oral contraceptives, they do not prevent sexually transmitted infections. So barrier protection, such as condoms, must always be used. Thank you for this opportunity to testify.
Thank you for your testimony. Broadcasting, next caller.
Chair, there are no more callers in the neutral position at this time.
Okay, thank you. And at this time, I do want to check Zoom. Is there Dwayne Young on Zoom to testify in the neutral position? If so, just please turn your camera on so that we can see you. There you are, Mr. Young. Welcome. I had you signed in, but I couldn't see you.
Good afternoon, Chair Hargy and the committee.
just hear from Nevada Medicaid to say that this is a budget neutral initiative, as this would just shift over recipients and providers and create more access to those on Medicaid. Thank you.
Thank you, Mr. Young. Okay, with that, Majority Leader? Perfect. I will now close the hearing on Senate Bill 190. Okay, members, the next bill on our agenda today is going to be Senate Bill 186. I see that we have Senator Spearman here with us today. Senator Spearman, we were expecting you on Zoom, so happy you could make it in person. I will now open the hearing on Senate Bill 186, which revises provisions relating to collection agencies.
My computer doesn't want to cooperate. Hold on a minute, it's loading. Thank you for your indulgence. Thank you, Chair Huddy and committee members. I'm Pat Spearman. I represent Senate District 1 in Clark County. Thank you for providing me the opportunity to present Senate Bill 186 to you today. This is an important piece of legislation that ensures impartiality when a collection agency seeks to collect a debt. This past summer, the legislature passed Senate Concurrent Resolution 1, which acknowledges that systemic racism and structures of racial discrimination are cause of profound economic and social challenges to our most vulnerable populations, by which I mean our BIPOC, Black, Indigenous, and other people of color communities. Because of the systemic barriers affecting BIPOC families, they have not had the opportunity to build generational wealth. However, they have been impacted by generational poverty. According to a report from the Board of Governors of the Federal Reserve System, 13% of adults with a bachelor's degree or more did not expect to pay their current month's bills, or would be unable if faced with an unexpected $400 expense, versus 42% of those with a high school degree or less. When you include race and ethnicity into the same study, BIPOC communities were even less able to handle a small financial disruption. Additionally, many other studies have acknowledged other financial inequities for BIPOC, such as 40% of borrowers in predominantly BIPOC communities had a debt in collections, compared to just 26% of borrowers in predominantly white areas. Debtors in BIPOC areas were twice as likely to have their bankruptcy case dismissed as debtors living in majority white areas. Borrowers of color were called nearly twice as often than white borrowers, despite similar rates of default and late payments. A study of collection actions in 3 major cities found that the risk of judgment is twice as high in majority black census tracts, and borrowers in majority black census tracts in one city were also 20% more likely to have their wages garnished after judgment. These findings and studies are noted from 2017, 2016, and 2019, during a time when we were experiencing the lowest unemployment in history. Due to the coronavirus, BIPOC families are struggling financially even more than they were before. President Biden has set an economic recovery agenda built on advancing racial equity. We, too, must participate by enacting legislation that removes any form of bias. That is why Senate Bill 186 is important, because it prohibits a collection agency from collecting certain debts owed to persons affiliated with or related to an owner of the collection agency. Here are a few highlights, Madam Chair. Section 1 requires each collection agency to file annually a report with the Commissioner of Division of Financial Institutions of the Department of Business and Industry that contains certain information pertaining to the debt collected for homeowners associations during the immediate preceding year. Specifically, the report must include the number of cases where a collection agency collected a debt for a homeowners association. Must include the name of the homeowners association and the amount of money collected for each homeowners association that the collection agency collected a debt for. Must include the total amount of money collected for each homeowners association, the zip code of each debtor from whom the collection agency collected a debt. The manager of the collection agency must provide a signed statement affirming the collection agency did not collect a debt against a prohibited person as provided in Section 2. Section 2 of the bill prohibits a collection agency and its managers, agents, and employees from collecting a debt from a person who owes fees to a homeowner association, a tow car operator, or a property management of an apartment building if the collection agency is affiliated to or a relative of a person who is the community manager for the homeowners association, tow car operator, or the property manager. If you will look at the 2020, September 2020 Gwen Center report about what's happening in Nevada, you will see that still many of our most vulnerable communities are the ones that are most hard hit by COVID-19 and its residuals. Mostly those persons who are in low-wage jobs, or we learned during the pandemic that they were also called essential workers. What we've learned is that for many of them, they are still struggling, just trying to make ends meet. For some of them, even though they have been called back to their jobs, one of the things that we do know, and the Wall Street Journal had an article on this a couple of months back, and that is, during the pandemic, one of the things that began to surge was technology and innovation. And disruptive technology increased about 25% during the pandemic. And so some of those who were recalled for their jobs don't even know if they're going to have a job a year from now because of the technological advances. So when you look at 186, and specifically, you should have a copy of the amendment for 186. It really is designed to make sure that these persons, once they have a home, they don't lose a home. And I know for some people, it's a matter of, well, it may be only 2 bedrooms, 1 bath. The carpet may need to be replaced, and there's some problems with the roof. But for the people who struggled and worked overtime and even borrowed money just to hang in there during the COVID-19 process, this is their home. This is their opportunity to begin a part of the American dream. This is their opportunity to begin to build some type of generational wealth. Madam Chair, I'd just like to go briefly through the amendments, and I won't read them verbatim. Number one.
Senator
for-
Spearman, if you would hold for 1 second, we literally just got a copy of the amendment. It was never sent to my committee manager or me to upload for the committee. I checked with my policy analyst and she was able to get a copy, so we're going to distribute the amendment and make sure the committee has it before we go through it. Thank you.
All right, so you all should have received that this morning, but okay. We can wait. We can wait. Madam Chair, you should also have a link for the Gwen Center report that people can reference as well.
And we're just waiting for the amendment to be sent to the committee members, Senator, and myself as well. Members, if you could check your inboxes, I think you should have received the amendment from our committee manager. Okay, looks like I just got it in as well. Okay, let's go ahead and bring that up. Okay, Senator, it looks like we all have the amendment now.
Thank you, Madam Chair. And again, I'll apologize. I was sure that we got that to you all about 9 this morning. Okay, no problem. Well, problem, but I apologize. So number one, provide a moratorium on HOAs moving forward with foreclosures until 1 January 2022 and increasing assessments until January 1, 2022. And this provision applies to all HOAs so that unit owners have a chance to recover from the economic hardships caused by the pandemics. We're only talking about 6 or 7 months, but for people who are still struggling, that could be the difference between them keeping their home, being able to pay at some point their HOA dues or not. And I think that it's important to also note that during the pandemic, many banks, as a matter of fact, most banks, provided forbearance for homeowners, and we had an eviction moratorium in place for those who rent their homes. The one thing that did not happen during the pandemic was to have a moratorium on foreclosures for people who could not pay their HOA dues. And so you did have homes that were foreclosed on during the pandemic, and many of the people that were foreclosed, it was a direct result of the fact that they had either lost their job, hours had been decreased, or other calamities related to COVID-19. Number two, provides that HOA offers excuse me, the HOA must offer unit owner a payment plan, and that's because very few people that I know of, if you're going to have a difficult time being able to survive financially with a $400 unexpected bill in during a month, it's going to be almost impossible for you to survive if you wind up all of a sudden owing at least $1,000 over 2 or 3 months. Provide that if an HOA uses foreclosure process, the home may not be sold to any person who was involved in the foreclosure process, including, without limitation, the HOA, a collection agency used by the HOA to collect an obligation relating to the property, a community manager of the HOA, and his or her assistants, an HOA board member, an attorney who represented any of the parties with regard to the foreclosure, any person who is related within the third degree of consanguinity to a person described in item 1. For purposes of this provision, any person who was involved in the foreclosure process means any person who exercised discretion and or any decision-making related to the foreclosure of a lien and a person employed by such a process. Madam Chair and committee members, I think that this is extremely important because not only is it a transparency issue, but for many homeowners, many times they have no idea, right now, they have no idea that the collection agency that where the fees are being referred to and the fees are mounting up also has an opportunity, once it's foreclosed and once it goes to auction, they have an opportunity to purchase that home. And for me, I just think that there's something wrong with that because if you are involved in someone losing their home, I don't think that you should be able to turn around and profit from that home. And I've been told that right now that is the case. Here's an example of why I think that that is nefarious at best. Someone can put a home into foreclosure, and the amount that is sold for in auction could be, for example, $150,000, maybe $200,000. Many of the homes especially in Clark County, are above $400,000. So let's say if that home, the market value, is $500,000, and we also know that because there is a limited supply, that sometimes homes are going for 10 or 15% more than what the market value is. Someone purchasing a home, and they were part of the foreclosure process, could purchase that home for $150,000. And if it's worth $500,000, that's $350,000 in instant equity. They can do whatever they need to do, $60,000 or $70,000 to clean it up or fix it up, and then sell it at a profit. Meanwhile, you have someone who has worked hard for that home, and they've lost it because they have not been able to pay their HOA dues. They're without a home. Someone who is involved in the process has a potential profit of more than $500,000. I just think that there's something inherently wrong with that process. And so that's one of the major reasons that I'm bringing Senate Bill 186. It requires HOAs to send notices and communications to electronic mail addresses designated by the unit homeowners, or unless they have opted out receiving electronic communications or have not designated an electronic email address. And that, too, again, is because during COVID, there was very limited transactions taking place in person, and most of what we did, to include those of us in this body, was done via electronic measures. Requires an HOA that has 100 or more units to establish either a website or electronic portal by which it can be accessed by its members. This provision would include, beginning January 1st, 2022, each HOA and a common interest community that has 100 more units must establish a website or portal and post on the website or portal anything related to the HOA, including, without limitation, recent copy of the CCRs, the HOA bylaws and rules, and any other documents required by regulation to be posted. Beginning January 1, 2023, these HOAs must establish on the website a portal the ability for unit owners to pay their assessments online. I don't know about you, but I rarely do anything in terms of payment. I pay my mortgage, my car payment, my insurance, everything I do is online. And so for people who are homeowners, especially during COVID and even after, in the aftermath of COVID, I think that it's important that it's a good public service and it's good for customer relations as well. So provide an opportunity for people to be able to pay their bills, their dues, or whatever online. HOAs with less than 100 units are authorized and encouraged to create such a website. Require community management to submit to the Real Estate Division of the Department of Business and Industry and the Commissioner of Financial Institutions an annual report that contains the name of each collection agency used by the community manager, the total number of past due obligations incurred in the HOA that were referred to a collection agency, the amount of each past due obligation as determined on the date that the obligation was referred, the zip code of each person whose past due obligations was referred to a collection agency during the previous year. I think those are very reasonable requests. And again, it provides a level of transparency that homeowners, specifically homeowners in BIPOC communities, do not have right now. Madam Chair, I also want to say, you heard me at the beginning of my testimony speak of systemic racism and systemic racist structures. I want to be very, very clear. I am not calling anyone racist. Let me say that again. I am not calling anyone racist. But we all know that there are systems of racism that have been used and perpetrated in this country for really centuries. And if we don't call it out, and if we are unwilling to have those courageous conversations, it'll never change. So again, when I said systemic racism, and incidentally, the CDC, the director of the CDC also said the same thing about a month ago. Racism is a public health crisis. I'm not calling anyone a racist. I'm simply acknowledging the fact, especially those of us who have lived in it, that there are things beyond our control that we have to address and we have to eliminate so that there is fair and equal balance for people to achieve and maintain the American dream. And with that, Madam Chair, I have some people on Zoom who are going to be part of the presentation. I think, yes, Ms. Jerry Burton.
Okay, welcome, Ms. Burton, when you're ready.
Thank you, Senator Spearman. Good morning, Chair, or good afternoon. Been on here a while. Chair Howdy and members of the Commerce and Labor Committee. For the record, my name is Jerry Burton, Jeriburton. I am the president of the Nevada chapter of the National Organization for Women, and I'm speaking in support of SB 186, representing our Nevada Now members. And Nevada families are struggling to recover from the economic collapse during the pandemic, and in particular in our BIPOC communities, as over 2 million women have dropped out of the workforce since February of 2020. And as we know, Nevada was hit the hardest. In Nevada, the types of jobs lost have been predominantly women, women of color, and single women who are head of households. And communities of color and women particularly have experienced higher HOA foreclosure rates because of this. This bill helps find ways to give homeowners a chance to recover from economic hardship, in many cases through no fault of their own because of the job loss in the pandemic, and where they may not even be able to pay the HOA fees. This bill helps eliminate abusive debt collection and protect consumers in Nevada, and we ask you to support SB 186. Thank you.
Thank you. I also have Nick with ACLU.
Hello, thank you, Chair Howdy and committee members. Again, this is Nick Shepak with the ACLU of Nevada. We want to thank the Senator for bringing this bill to our attention and really allowing us to be part of the conversation. This session, in a variety of committees, this body has heard legislation that deals with fines and fees. And what we have found is really two things are consistent, whether it's with traffic tickets, driver's license suspension, the towing of motor vehicles, is that one, we lack a lot of good data here in the state. So what this bill will do with data collection will help both the legislature and community organizations such as ours and those that work with people who are experiencing financial hardship. It will allow us to really find out if there is this type of predatory HOA policies in some areas. And it'll help us understand that even if there's not predatory policies, who is being most effective? What we know from previous research is that communities of color often get hit more often and harder with HOA fees. And we've seen HOA fees start as low as $700 and rise to a level because the individual who owns a home is unable to pay, especially during financial hardships such as the pandemic, where those HOA fees get so high that then they have a lien put on their house and they can lose their home. Their home is foreclosed on. And we really need to have a better understanding in Nevada of how this practice is working, who is involved, and who is being the most affected by it. So that's one part that the ACLU is excited for with this piece of legislation. We really think that this data will help us and help you all create better policy. Secondly, the moratorium on the HOA foreclosures is really a piece that we feel is a gap that was missed during a lot of the good protections that were given during the pandemic, whether those were protections for renters or protections for homeowners. We think there was an unintentional miss probably here. And now we have individuals who, as has been previously mentioned, have lost their jobs during the pandemic. And they may have these HOA fees building up. These are often easy fixes once people have the time and the money. And by creating a moratorium just to the end of the year, we think we can save a lot of people in their homes. And lastly, one thing we'll say is that generational wealth is built through home ownership. It's one of the key indicators of generational wealth. And it has been one of the things that has helped keep certain communities in poverty in this country. And so whatever we can do to better understand why people are losing their homes and to prevent people from losing their homes will not just have an impact in the immediate future, but will have a real positive impact on these communities in Nevada for a really long time to come, multiple generations. So we think that there's a lot of common sense in this bill, including the amendment, and we really urge you to support it because if we can't measure what's happening, we really can't address it properly. And so with that, I'll leave it at that for now. And I thank you again for your time and allowing me to be here in this committee.
And have someone from the Legal Aid of Southern Nevada. Madam Chair, he may be on the phone. I think he was having some issues with internet, so he may be on the phone.
Okay, then we'll have to probably get to him during testimony and support, Senator.
Okay. Thank you. That's all that I have for right now, and can stand for some questions.
Okay, members, do you have questions for our presenter? I'm going to go to Assemblymember Kasama first.
Thank you, Chair. Assemblywoman Kasama, District 2. Thank you, Senator Spearman. So my question, I'm just kind of going through this amendment as well that we just received here, where you've got a moratorium on, I'm looking at the Section 1, a moratorium on foreclosures through January 1, and restricting the fees. So the problem is we went through this in 2006. We had HOAs that were devastated by non-collection of fees. And they're, they were losing, they couldn't keep up the communities. They're tasked with collecting money to keep up the communities. And we saw the devastating effects of that. It took them many years to recover from that as well, along with everybody else. My concern is here, again, we're putting a burden on private properties. And I understand the issues on individuals if they've lost their job or there's hardships. But we've also had a lot of federal and state assistance that has come, that has been assisting people. We have unemployment, we have federal programs for bills, for money support for individuals. So I don't see that this is a good move because, again, the burden is on the HOA. Just like we had with housing providers, the burden was on them. If you need something, then again, you can't put it on private people. Then we have the government step in and provide subsidies to people, but not on the backs of the private individuals and private companies. And so I have a lot of trouble with this bill. And the foreclosures, you say that's 6 or 7 months. The foreclosure process in this state now takes over 7 months. So we're going to be there next year anyway. And I don't think with the, what's going to happen with our court systems, they're going to be overloaded. I don't see any of this happening rapidly anyway. And to put COVID regulation into the statutes when we're looking at opening up 100% in just a month or two here doesn't make sense to me.
Thank you, Madam Chair. Is that a question or statement? Question?
Well, I guess the question is, I don't see how putting the burden on a private ownership, HOAs, you're putting a burden on them as well. You're transferring the burden from one party to another, and I don't understand the rationale behind that.
Thank you, Madam Chair, through you to the Assemblywoman. So I think that is a good observation that sometimes the government is able to step in. But I also think it's a good observation to note that there was a bill in Congress passed by the House in May of 2020, and it never made it out. And there were people who desperately needed that. They desperately needed the additional money for unemployment. There's additional money for health or for departments of health. There are a lot of different things that were in there, and it got hung up. So does sometimes the government able to step in? Yes. But one of the things that I do know, and this is not to take anything away from what the HOAs have to do, you have people who have lost their jobs, and they've had to figure out how they're going to either pay their mortgage, how they're going to put food on the table. Some of them had cars towed because they had registration that was outdated, while DMV had a banner on their website saying that all of these things, registration, license, et cetera, there was going to be a moratorium on that. So you have people in our community, our neighbors, people that we go to church with, people that we shop with. You have them who are struggling. They had to try to figure out how to balance their budgets basically on nothing. And a couple of the things that I know that HOAs do is they're supposed to keep the grass cut in common areas and make sure that the trash is picked up. If you live in a gated community, you're supposed to make sure that the gate works. And the community that I live in, the gate is inoperable at least 3 or 4 times a month. So what I'm suggesting here is that, number one, a moratorium on the foreclosure. Where are these people going to go? I mean, really, where are they going to live? They foreclose on the house. Opening up in a few weeks doesn't mean that everything is okay. There are still people who are suffering. There are still people who don't have a job. There are still people who have, even if they've been called back to work, their wages have not gone to the same level that they were before the pandemic. And I would encourage you to look at the Gwynn report on the impact of COVID-19. It's people of color who are really bearing the burden of the vicissitudes of COVID-19, in that whatever financial obligations they have or have had, those have been ongoing. Whatever assistance that they have gotten from either state or federal, for many of them that I've talked to, especially those in my district, this is not correct English, but it ain't been enough. So all I'm saying, I'm not telling them to stop. I'm saying put a pause, push the pause button until January. With respect to the fees, put a pause until January. Give people an opportunity to save their homes. Give people an opportunity to do that. That's all I'm saying.
Thank you. follow-up, Assemblymember Kasama? Okay, thank you. Assembly members, any other questions for our presenter? Okay, Vice Chair Carlton.
And thank you, Madam Chair. Since we just got the amendment just recently, it's a conceptual amendment. Is it meant to delete the second part of the bill, which has to do with tow cars? Is that still in there, or is that coming out? Because it doesn't seem really related.
Thank you, Madam Chair. Through you to the Vice Chair Carlton. Yes, ma'am, it stays in there, and the relationship to that is the fact that it's the consanguinity, it's the people who many times have a direct relationship with tow car companies. And you might remember a bill that came through.
And that's fine. Thank you, Senator. I just wasn't sure with the conceptual if it was included or not included.
Yeah.
So that provision is still in the bill. Thank you very much.
Okay, and I think that was my question too. Okay, about whether it was deleting the sections. So, members, any other questions? Oh yes, Assemblymember Considine. Short-term memory right there.
Thank you, Madam Chair. Thank you, Senator, for bringing the bill. I had a question. It would be, well, in the amendment, it's somewhat of the same language that was in the original bill. In the Section 6, the third point in that, where for data collection, you're saying the amount of each such past due obligation. It's kind of the same language that you have in the original. My question is, if you're looking at like the disparate impact and you're gathering data, what was the rationale for asking just the amount of the obligation or the total amount of the debt and not separating those into assessments and fines and fees? Because I know in most experience, it's those fines and fees that end up causing more foreclosure than just the assessment. So I was wondering if there was a reason why you didn't have those separated.
Thank you, Madam Chair. Through you to Senatorwoman Considine. Here, so.
Senator, you can go directly to the members.
Okay, thank you. So the rationale is, at first, the objection by some in opposition was it's too much data. So to make sure that it is consolidated to a workable or manageable amount, this is why we have that in there. We can certainly go back and make that determination. And as a matter of fact, most people, when they keep their records, they make that distinction. They make a distinction, you know, when you look at your household budget, you make a distinction between what your water bill was and what your gas bill is. So if you were to ask me what was your water bill the last year, I can go back and tell you. If you ask me what was the total of your household expenses for a month, I could go back and tell you. If we're going to disaggregate the information, most people already have it. But for the sake of making sure that it didn't seem onerous to some people, we just wanted to make sure that this information was gathered. And I would also say, and I was looking for the page, and I can't remember the page, it is in the Gwynn Center. One of the things that the Gwynn Center says is that we don't have the type of data collection that we need to make sure that all the communities, all of Nevadans are receiving the same type of support and the same level of support to dig themselves out of this. And they suggest or recommend that we implement several different ways that we can collect the data so that we know that. Thank you.
Thank you, Senator. I appreciate your answer.
Thank you. And Senator, you keep referring back to this Quinn Center report, but we did not receive that as an exhibit to upload either.
Yeah,
so if you could get that over to us so we can share it with the committee and then.
Yes, ma'am. I sent a link, and I can make sure you get the actual report. It's online, but I sent the link to the report as I got it offline. But I can make sure you get that too.
Thank you. Mm-hmm. Okay, members, any other questions? Assemblymember Hardy.
Thank you, Chair. Thank you, Senator. So I just had a little question on the conceptual amendment on number 3, where you talk about in a foreclosure, you know, who would not be able to purchase a home. So, and I think you were kind of going to get into this a little bit, but why it seems to go quite far into who would not be allowed to purchase a home. And So just if your thought process with that, and then also, why were you looking at putting into statute who could buy a home in this way?
Thank you. Senator Hardy, right now, if you have a collection agency, you yourself have a collection agency, and you also own an HOA. And the delinquent account for the HOA company that you own was sent to the collections company that you also own. Everything that happens to that piece of property, you, the people from the HOA, and anyone else that's involved in that process knows exactly what's happening. More importantly, know when it's getting ready to come on the market. It's a matter of transparency, and for me, it's also a matter of fairness. I am not trying to stifle anyone from making money. I just think that an incestuous relationship like this that currently exists, I believe that it harms the former homeowner. And this is one of the ways to make sure that they know. Because, and listen, I'm not casting aspersions or trying to castigate anyone. But here's one of the things that we don't know. In the foreclosure process, and I think it was 102 or 103 for homes that were foreclosed on in 2020, the end of 2019 and 2020, 102. Let that just sit with you for a minute. And that goes into a pandemic when everybody was supposed to be staying at home. So you have that number of homes being foreclosed, and you also have people who have knowledge of that, knowing that it's coming to the market. The people who have lost their homes right now have no idea if the process that was used to foreclose on their homes, they have no idea whether or not it was fair to them. Doing it like this puts a level of fairness and transparency in there for the homeowner. You can buy property. You can go to auction and buy anything you want. Car, house, condo, you can do that. The thing that we're saying here is that if you've been a part of the foreclosure process, no, find another way to buy a house. You can do it, just don't do it this way on the backs of poor people. That's all I'm saying.
Okay, members? Okay, seeing, Speaker Frierson?
Thank you, Madam Chair. My colleague had brought up a point, and I just wanted to revisit it just for clarity's sake. A good chunk of the presentation has been about homeownership and the impact on communities of color, particularly during pandemic, but not just during pandemic. But it seemed to be less tied to I just wanted more connection with the toll section of it, because that's less to do with a lot of that. And don't get me wrong, I don't deny there are issues with respect to towing practices across the board, but it seems to be separate from a home ownership issue. So could you reel that in for me?
Yes, sir. Thank you, Speaker Frierson. So the tow piece was actually placed in there as a result of some of, not just my constituents, and sometimes I don't know if they really are or not unless I ask them for the zip code, but when people call and say my car was towed, and when you look at, there are times when tow companies have a relationship alignment with apartment complexes or HOAs. And I think that was very similar to what Assemblyman Miller's bill talked about. And so we're really talking about being able to seize property and doing it in a way where there's no transparency and where the owner of the vehicle or the owner of the home really has nowhere else to go. Here's an example. If you looked at the governor's initial emergency declaration, you won't see tow companies listed in there. But I think it was maybe the second iteration of that. You will see tow companies listed there. And here's why. When the Strip shut down, many of the tow companies were then going to apartment complexes, and they were towing cars whose registration was out of date. And they were impounding them. And for some people, it went up to as much as $2,000. The person has lost their job, and I'm not laughing, they lost their job, hours have been cut back. They don't know what they're going to do. Now, the apartment complex manager has called and said, these vehicles are coming, look at this and see which ones are out of date. And so that's why it's in there, because it is also a matter of transparency. And if you look at what Assemblyman Miller brought, there is a close connection with what he is saying in his bill and what is being said in this bill. So to leave the Strip and go to apartments complexes, and those too are primarily occupied by people of color. And to have that level of financial burden placed on you. And so for some of them, they couldn't make the car payment. They certainly can't pay $2,000 to get their car out of impound. So what do you think happened to them? Yeah, so that's the connection. And I hope I answered your question, sir.
If I may follow up, you did. Just so I'm clear with respect to the toll aspect of the bill, it still requires that there be a relationship, and that relationship as defined as within the third degree of consanguinity?
Yes, sir.
And so that would still be applicable to the toll activity?
Yes, sir.
And just so, because we now put that out there, are you saying that you have gotten calls from folks that toll companies, because of a lack of business in other areas, just went without being summoned to apartment complexes and ID'd cars that had an expired tag and just told them?
Yes, sir, that's exactly what I'm saying. And if you will look at some of the reports that are in BNI, you will see that. And the number of automobiles that were towed escalated after the Strip shut down.
Thank you. Well, I'm going to look into that because of my own curiosity about the ability of a tow company to go on a private property, because frequently I have a tag in my glove box that I forgot to put on my car. And having been a victim of a stolen car, I've also had a car towed and subjected to fees as a victim, which kind of caught me off guard. This is different. I mean, because I think that the bulk of what we're talking about was home ownership and the pandemic. And I think that this is a different issue. I mean, it's tied obviously with respect to collections, but I do think it's a different issue and could open the door to a lot of other, I think, inequities in the practice of tow yards. But I will digress because I want to look into that myself.
Thank you, sir.
Members, seeing no further questions, I'm going to move into testimony portion of the bill hearing. I would like to remind everyone that I'm going to take 20 minutes in support, 20 minutes in opposition, and 20 minutes in neutral. Seeing no one here in Carson City to testify in support, I will go ahead and check Zoom. Is there anyone on Zoom wishing to testify in support? If you would just please turn your camera on and raise your hand so that I could see you. Okay, broadcasting, can we go to the phone line?
To testify in support of Senate Bill 186, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 199, please slowly state and spell your name for the record. You'll have 2 minutes and we begin.
Thank you, Chair and members of the committee. For the record, my name is Tess Opferman. That's Opserman, speaking on behalf of the Nevada Women's Lobby.
SB 186 takes an important step for consumer protection and transparency. We need to start observing the practices of debt collection happening by homeowners associations so we can have a better idea of what debts are being collected, when, and by whom. Which homeowners associations are more pervasive with debt collection? What populations are they targeting and what zip codes? Nevada needs to do better at looking into this so we can better protect our residents. Furthermore, we need to ensure that debt collection agencies are not directly benefiting a relative who may be the owner or operator. We thank you for your time today and urge your support on SB 186.
Thank you for your testimony, Ms. Offerman. Broadcasting, next caller.
Caller with the last three digits of 193, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Good afternoon. My name is Peter Aldous, Peteraldous. I'm a staff attorney at Legal Aid Center of Southern Nevada. I'm calling in support of SB 186. I've represented many Nevada homeowners as they've tried to resolve fines and assessments with their homeowners associations, and many of those homeowners were very frustrated because they could not work directly with the HOA boards. This is because their files were placed with collection agencies, and too many of those collection agencies place their own profits over a prompt and efficient resolution of the issue. The inherent conflict of interest that arises when a community manager is financially related to a collection agency is unacceptable. Community managers should be focusing on helping homeowners, not extracting money from them. Thank you, Chair and committee members, for taking the time to address this important issue.
Thank you for your testimony. Broadcasting, next caller.
Caller with the last three digits of 656, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Hi, Chairwoman, members of the committee. Will Craigman representing Battleborn Progress. That's WILLP as in Peter, REGMAN. We rise in support of SB 186. Our housing crisis in Nevada simply must be addressed. The pandemic has made an already precarious problem much worse, and this legislature must work to keep people in their homes. SB 186 would help study conflicts of interest between HOAs and debt collection agencies that lead to abuses of power and undue harassment and hardship for BIPOC communities. This bill is about protecting the homeowner from predatory behavior that lessens the ability for certain communities to access home ownership. We thank Senator Spearman for bringing this forward, and we ask you to support this bill. Thank you.
Thank you for your testimony. Broadcasting, next caller.
There are no more callers in support at this time.
Thank you. Seeing no one here in Carson City, if there is anyone on Zoom, please turn your camera on and raise your hand. Okay, broadcasting, if we could check the telephone line for anyone wishing to testify in opposition.
To testify in opposition of Senate Bill 186, please press *9 now to take your place in the queue. Chair, there are no callers in opposition at this time.
Thank you. I'm seeing no one here in Carson City. Is there anyone on Zoom wishing to testify in neutral? Please turn your video on and raise your hand. Okay, broadcasting, could we go to the telephone line?
To testify in neutral on Senate Bill 186, please press *9 now to take your place in the queue. Caller with the last three digits of 420, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Hi, good afternoon. This is Garrett Gordon, Garrett, last name Gordon, Gordon. I'm with the law firm of Lewis Roca, and today representing the Community Association Institute, which is the trade group that speaks for the 3,000 homeowners associations in our state.
I signed in as neutral in that the bill as written, as is, without the amendment, we are neutral on. However, with this proposed amendment, we do have some concerns. We have passed those concerns on to Senator Spearman and always appreciate the time and work that she does in allowing us to have a seat at the table. Of the proposed 6 conceptual changes, I'll summarize 2 of them we are in support of. 2 of them I think we can get to neutral on with some changes, but a few of them we certainly have big concerns. Regarding number 1, we respectfully oppose a moratorium on HOAs, given HOAs are nonprofit entities that have zero balanced budget each year. If an HOA needs to increase assessments for the purpose of paying costs of services, insurance, water, power, gate maintenance, pool maintenance, this would stop an HOA from making needed increases and put the HOA in a position of having to eliminate services. In addition, if you are capping or putting a moratorium on assessments, it now doesn't allow an association from, say, entering into payment plans with homeowners. I think that's very important to hear. I heard you heard some testimony today about folks who have gotten behind and had some trouble. And there is already in statute, we worked very hard, I know many of you on this committee remember, with Senate Bill 306, with now Attorney General Aaron Ford, regarding increased payment plans, regarding increased notice, regarding redemption opportunities for homeowners to redeem their homes. As I understand it, that system is working, and we would submit to you that the amendment as written is not necessary. There is no prohibition of HOA foreclosures. This bill and its sister bill, I would say Senate Bill 144, that died in Senate Judiciary, some of these concerns were mentioned, and so we spent hours upon hours researching what happened in the last 8 months in regards to HOA foreclosures. And I can tell you in Clark County, of the approximately 900,000 HOA units in Clark County, again, that's 900,000, there were 33 total foreclosures in the last 8 months in 30 different HOAs. So there was no proliferation of HOAs foreclosing, no particular HOA. We were also asked to look into the zip codes. It's clear from every zip code in Clark County there is between 0 and 4 foreclosures. So again, I'd like to sit down with Senator Spearman. Maybe hopefully we can come to a compromise on some of these conceptual amendments. But again, if the committee just processed the bill as is, we are neutral on that. Thank you for the time, and I look forward to working with the sponsor. Thank you, Madam Chair.
Thank you, Mr. Gordon. Broadcasting, next caller.
Chair, there are no more callers in the neutral position at this time.
Okay, thank you. Senator Spearman, would you like to give closing remarks?
Yes, ma'am. Thank you, Madam Chair. I just want to respond to Mr. Gordon's concerns. And again, when the bill that he referred to about HOA, when that was worked on, we were not in a pandemic or just a few months outside of the pandemic. Again, this is not saying indefinitely. This is saying until January 2022. This is saying have compassion on the people who have had to tighten their belts, homeowners who have had to tighten their belts. I don't begrudge, HOAs. I've bought and sold 4 houses since I've been living in Nevada, and every one of them had a HOA. I pay my dues. What I'm saying is that there are some people who have not been able to do that. And all they have to do is push the pause button. Push the pause button. Maintaining the common areas, okay. I don't know, I honestly don't know if that's $2,000 or $3,000 a month, I don't know. And like I said, in my HOA, and we've been telling, in my community, we've been telling the HOA for I don't know how long, the gate is broken, why don't you replace it? And they come out 2 or 3 times a month and go tank, tank, tank with a hammer and a screwdriver or whatever, and the gate works for another 4 or 5 days and then it doesn't. We're not saying don't. I'm simply saying, please have compassion on ordinary people who are struggling and trying to make it. I don't know how else to put this. I would just say this. If you go to the Gwynn Report acknowledges that there is an imbalance of wealth within BIPOC communities, and in some instances, it is as much as 40% difference. 40% difference. You don't have to stop the process. I'm simply saying, push the pause button. In Judaism, they call it tikkun olam. In Christianity, tikkun olam means to repair the world, and that is looking at things that may not be quite where, quote, God would want them to be. You do all that you can to make sure that they get there. I happen to be a Christian, and the book that I read is known as the Bible, and in the New Testament, the carpenter's son says it like this: what you have done to the least of these, you have done it unto me. We're talking about helping the least of these. The least of these. Many of them have had no money or very little money to even feed their families. So again, I say, anyone on the phone, Mr. Garrett, and we've had this conversation before, I am not saying to stop the process altogether. I'm simply saying what you have done to the least of these, the carpenter's son says, you have done it unto me. Thank you, Madam Chair.
Thank you, Senator. Committee members, with that, I am going to close the hearing on Senate Bill 186. Okay, this brings us to our last bill on the agenda for bill hearings today. And I do see our presenter here. I'm going to give them a few moments to switch out presenters before I open the bill hearing. Welcome, Senator. Welcome. Mr. Alonso, okay. Committee members, I will now open the hearing on Senate Bill 307, which revises provisions relating to the sale of alcoholic beverages. Welcome, Senator Dondera Loop. Welcome, Mr. Alonso. When you are ready, you may present.
Thank you very much, Chair Howdige and the members of this committee for allowing me to present Senate Bill 307. I am Marilyn Dondero Loop from Senate District 8 in Clark County. This bill that you will hear for your consideration builds upon our previous effort concerning the sale and distribution of alcoholic beverages. Almost every session, the legislature has contemplated and enacted legislation involving malt beverages and distilleries, and in the past decade, Nevada's brewery and distillery businesses have grown each year. According to the American Distilling Institute, craft distilling grew into almost a $1.8 billion business in 2019, directly employing thousands and indirectly supporting thousands more in related businesses. At retail, these sales were reportedly worth nearly $3.2 billion. Although the COVID-19 pandemic did drastically affect our craft distillers, Nielsen's market data reports that total alcohol sales outside of bars and restaurants surged roughly 24% during the pandemic. Alcoholic beverages are generally governed by the 21st Amendment of the Constitution. However, individual states control the sale of alcohol within the state, distribution of alcohol within the state, importation of alcohol within the state, and statutes regarding to who can possess alcohol within a state. In turn, state laws often assign different roles and responsibilities to local jurisdictions regarding the above issues. Accordingly, Senate Bill 307 contains several provisions addressing each of the above issues, making various changes to the regulation of brew pubs, craft distilleries, suppliers, and wholesalers. Chair Hadigi, at this time, I would like to turn the presentation over to Alfredo Alonso, Principal of Lewis Roca Rothgerber Christie LLP, who will further discuss the bill. And Chair, I will stay as long as I can. I have a meeting that starts at 3:30, and I know many of us in this room have to be at that same meeting, but we also have people that are doing bills. So if you don't mind, when I'm ready, I will excuse myself.
And that's fine. Thank you very much. Mr. Alonso, if you'd like to go ahead and proceed.
Madam Chair, members of the committee, Alfredo Alonso today with the law firm of Lewis Roca on behalf of the Nevada Beer Wholesalers Association and Southern Glacier Wine and Spirits. And what you have before you in SB 307 is an attempt to, there are basically three parts to this. There were many issues that were that were occurring within the marketplace. Our discussions with the tax department and how to fix some of those. You will notice in the latter half of the bill where we deal with the gray market issue in Section 6. That's an important piece because we've been here before having the discussion about it where someone can purchase liquor, be it through, we've seen private means from weddings from other countries, in many cases not an exclusive agreement with a supplier, and then they come in and they try to get a license or a certificate of compliance as if they were the exclusive entity. We are trying to fix that and make sure that unless you are a supplier or the official importer for that product, you can't simply get that license. The other issue that came up with respect to Section 7 was many years ago, there was discussion about how to allow someone who goes to a distillery, and in this case, at the time, it was a small distillery in South Lake Tahoe, and they wanted to bring back, I think probably Assemblywoman Carlton may even remember this, bring back a gallon of these spirits, and there was nothing in the statute that would allow for this. So at the time, we put in language. Legislature decided to allow, and the word import was put in the statute. Import today means a much different thing. So we are changing that per discussions with, obviously, the regulators that entering the state with clarifies what this body had intended at the time. And then the last piece that dealt with, again, more housekeeping than anything else, if you go back again to Section 5, excuse me for skipping around, but in Section 5, and it is the last section there, it basically says, and we've had some issues with local governments not looking at the statute and understanding what type of license should be issued to someone. All we're doing there is saying you need to look at these chapters, or this chapter and this and these sections. Nothing new. There's nothing in there that is that is not out of the ordinary. They are simply being directed to look at that as well. And the Department of Tax felt that would be a good way to get them to issue the proper licenses in the future. And then we go sort of to the heart of the bill for the wholesalers, and those are sections 1, 3, and 3. Section 1 dealt with an issue that one of our wholesalers had a couple of years ago now. Many of you may remember the Gilketz's family and Bonanza Beverage. What happened in that case is a supplier refused to allow a transfer, which meant allow the purchase to go on. And they didn't say yes, they didn't say no, they just essentially sat on the question, and it irreparably hurt this family and their ability to sell their business and devalued their business significantly. And so what we're doing there is basically saying the original language in there was to require 30 days. After extensive discussions with other suppliers, we hope to have an amendment for you here shortly. In fact, it's been worked on as late as probably an hour ago, but it would essentially allow for a 60-day period, and the supplier would grant or deny the request in writing. If there's an opinion, they would indicate what that opinion was, whether it was a yes or a no, and then there's some additional language that'll go in there to make sure that, again, both sides feel that's a fair way to handle this. But either way, the wholesaler would have an answer. Again, there's a process. We think that is a good compromise. And then sub 5 of section 3 is the credit issue, and that has been probably the most difficult of all. And that dealt with a supplier choosing to end credit terms for our wholesalers. We are hoping to have something more definitive than this, but right now, again, we've been trying to work with the suppliers on this, and we continue to do that. That is our goal, that in the next 24 hours at most, we hope to have something more definitive. But currently what that says is, if you are a supplier and you're giving someone or requiring inventory, you would also have to require or provide credit for those days of inventory. So if you, as a policy, say, this wholesaler has to have 20 days of inventory, 15 days of inventory, whatever it is, there would be credit terms for those days. And again, that's been probably the most contentious piece here, and we'll continue to work on that. And then the last piece was on what we call buybacks, which is essentially a term used when the supplier might owe the wholesaler. It could be anything from a group of beer fridges or an overage of some sort, and some of our folks have had trouble getting reimbursed in a timely manner, and that can be a real problem. So I think there's going to be some new language there as well that I think both sides can live with. That will probably bring that to a 30-day period of some sort under certain circumstances. So again, the hope is to have consensus on that as quickly as possible. And then one of the last pieces, we've been working with some of the brew pubs. They indicated that some are trying to get more beer to sell in Nevada, but they also have obligations outside of the state of Nevada. And these are, again, small brew pubs, probably on the bigger side. We worked with them to come up with an idea that essentially allows them to sell, without hurting those caps, sell an additional 20,000 outside of the state, so they'd be able to export more, which leaves us with more beer for our wholesalers and a public in Nevada. And you'll probably hear one of the folks we've been working with is Jeremy at Revision Brewery, and I believe he's going to be on the phone or online to discuss his situation as well. But again, my hope is that we come back to you with an amendment that everyone can live with. This has been a very tenuous and difficult situation, but again, the hope is to make this as simple as possible. And I've got Leif Reed on the line as well. If there's any questions or if he has something that I missed, perhaps he could go into it.
Was Mr. Reed going to provide remarks as well?
Yes, ma'am.
Mr. Reed, would you turn your video on so we can see you? Hi, welcome, Mr. Reed, when you're ready.
For the record, Leif Reed from the law firm of Lewis and Roca. I don't have anything to add. I'm happy to ask questions. We didn't give a lot of the background very briefly. The main provision in dispute was enacted 4 years ago. It was enacted. We urged the legislature to codify protections that had been negotiated by the Department of Justice to ensure that small suppliers, small producers of beer and craft liquors would have access to market. That's why that provision is so important. I don't need to go into detail on that, but that's why the provision is there. We're trying to negotiate a solution that where the breweries can be more satisfied with that provision, but in the event they're not, we have that provision there. The legislature enacted it for an important purpose, which is to prevent the monopolization of the beer and liquor market. So I would conclude with that unless any questions are directed to me. I'll mute myself.
Thank you, Mr. Reed. At this time, are we ready to go to Q&A, Senator?
Thank you, Madam Chair. We are.
Okay, perfect. Members, any questions for our presenters? I'm going to start with Vice Chair Carlton.
And thank you, Madam Chair. So my curiosity was piqued, and I had heard about this briefly earlier, about the wholesaler relationship and the amount of stock that needs to be kept and the credit issue. So just knowing that if you have the contract and the way the system works, so if I decide to carry a certain brand, I'm required to carry a minimum inventory. I don't get to choose how much I'm going to order. I'm told what the inventory is going to be. But then there was apparently an issue with the credit. So I guess I want to understand exactly how these are going to fit together. If it's mandated I have to carry that inventory if I want that product, but I'm not given the same amount of time on credit to actually pay for it, the business relationship puts me at a disadvantage because I'm having to pay out. I'm just trying to figure out how this all works. And if it ends up being cash on demand, that's even a bigger burden because I'm being told how much to carry, but then I end up having to pay cash on delivery. And we know what stock looks like. I mean, we're not talking small stock here. I understand. I think we're talking, warehouses full. So I'd like to understand that provision a little bit better.
Madam Chair, to you and through you to Vice Chair Carlton.
And you can go directly to the members, Mr. Alonso.
Thank you. With respect to our wholesalers, I think it's important to note that a wholesaler pays the state excise tax the moment they get the beer. So whatever liquor it is, wholesalers, before they do a thing, pay the state. So that is, the state is made whole immediately. Number two, we have credit terms. So we are required to provide credit terms to every one of our customers, no matter how small the bar is, to a casino, to everyone. And that is, it is essentially 45 days before you can go on COD. And as everybody knows, during the pandemic, we've all gone far and exceeded that to make sure that our partners on the retail side have product, even though in some cases we've gone beyond that. The whole goal was we need to keep folks solvent. We need to keep them around. So what has happened to some of our wholesalers is that a particular supplier cut our credit in response to what was passed 4 years ago. And again, They have their reasons for it. We disagree with that, but it just makes the marketplace so much more difficult when you have to go COD on required inventory. And yes, in many cases, it's a very large amount. And ultimately, you're paying both the COD, you're paying, and mind you, for some wholesalers, it's easier than others. Our smaller folks obviously have a much more difficult situation. Those that may carry some debt may be on a credit line. So they're actually having to pay interest to pay that off. And it just makes things more difficult when you're giving the rest of their customers credit, but they have none themselves. So that's basically how it would work.
Thank you, Vice Chair. And again, I want to repeat that just so I understand it, because I think they have to pay cash on demand, so they're out the money that they pay for the inventory right away, instantly. Then they have to pay on top of that taxes, the state excise taxes, so they're out the taxes. Then this is the part I want clarification on. Is it in statute? They are required by statute to extend credit to 45 days? So then by statute, they're required to extend credit for 45 days, so now they're also out that. So they really can't make up that money for a possible 45 days.
Correct, Madam Chair. And again, I think it's really important. It's a value of money. I mean, it's every one of these individuals having to, again, in this environment, our sales are down. Our on-premise is finally coming back, but it's been a year of doing your best, keeping your employees. Our folks have worked very, very hard to do that. And at the end of the day, we're extending as much credit as we can. It makes it a difficult go. Certainly does.
Members?
Madam Chair.
Oh, Senator, yes.
Excuse me, Marilyn Dondero Loop for the record. I'm going to excuse myself because, and then there were two only in my committee, so I need to be one of the ones of two.
Yes.
So thank you very much for your time, and I'll leave my bill in capable hands of Mr. Reed and Mr. Alonso. Thank you.
Yes, we appreciate you joining us, Senator. We understand duty calls. Members, any other questions for our bill presenters? Okay, seeing none, I'm going to move into the testimony portion of the bill hearing. I'm going to start with testimony and support. I don't see anyone here in Carson City for support. Is there anyone on Zoom? If you would just please turn on your camera for me. And raise your hand if you're testifying in support. Okay, I believe that is Mr. Warren. If you would just unmute yourself and begin your testimony.
Thank you, Chair and committee members. My name is Jeremy Warren, Jeremy Warren. I'm the CEO of Revision Brewing Company in Sparks, Nevada. We are in support of SB 307. This bill will allow Revision Brewing Company to invest over $8 million into future expansion projects into Sparks, Nevada and Las Vegas, Nevada. With these expansions, this is going to help us create more jobs, between 30 and 50 more jobs, mainly in the Las Vegas market with some additional in the Sparks, Nevada market. SB 307 will also help Revision to be more competitive with our out-of-state suppliers with the production capacity increases by allowing Revision Brewing Company to tap into better economy of scale. As a representative of Nevada's largest brewery, we feel nothing in this bill will inhibit the growth of Nevada's craft beer industry and will protect their local distributors from unfair practices imposed on them from large out-of-state suppliers. Finally, I'd like to also add that Sean Turner, the owner of Mammoth Brewing in Mammoth Lakes, California, which just acquired Lead Dog Brewing Company in Sparks, Nevada, wanted me to express on his behalf full support of SB 307. Thank you.
Thank you, Mr. Warren. Is there anyone else on Zoom wishing to provide testimony and support? Okay, then broadcasting, if we could move to the phone line, please.
Testify in support of Senate Bill 307. Please press star 9 now to take your place in the queue. Chair, there are no callers in support at this time.
Okay, thank you. Is there anyone in Carson City wishing to testify in opposition? Welcome, Mr. Hillerby.
Thank you, Madam Chair. Michael Hillerby on behalf of Anheuser-Busch. Thank you for your time. As Mr. Alonso alluded to, we are in active negotiations now and are optimistic that there may be something to bring before you to work out the details. Having been involved in those issues with a number of years, as have some of you, we know it's not particularly productive to have these disagreements in front of you on fairly sophisticated contractual terms, and not something on which you would want to spend much of your time. I'll just focus on our opposition specifically to sections 1 and 3 of the bill as written. We do, in fact, want to figure out ways to extend credit, to do that in a way that gets Anheuser-Busch and other suppliers useful financial information that also provides the necessary protections for the wholesalers on the information that they provide and keeping parts of that confidential, but would enable suppliers like Anheuser-Busch to be able to extend credit again. Also, in terms of the transfer of ownership in Section 1, that's another area where, again, we don't think we're too far off. One of the key provisions of that, and it's in line 8, talks about the wholesaler's rights and obligations under the contract. Those contracts include specific information about what is required to activate that transfer process. So that's one of the things we're working on, is when does that clock start ticking, whether it's on the notice of the request or upon submission of complete information as required by the contract. Again, I think there's been productive movement made over the last few days, and as Mr. Alonso alluded, we understand you have a deadline coming up, as do we all, and if you could give us and encourage us to get this done in the next 24 hours or so, we would love to come back to you with something that makes this work for the different parties. I would be happy to answer questions.
Committee members, Assemblymember Dickman?
Thank you, Chair, and it's not really a question, but I think so many parts of this bill are great, and the parts where we have issues, I'm glad to hear you're working on them, and I hope we can work them all out. Thanks.
Members, any questions? Oh, Vice Chair Carlton?
And thank you, Madam Chair. And as it's been aptly said, this is not my grandfather's Anheuser-Busch, and I mean that really. He was a Teamster at the brewery in St. Louis. So I grew up with Anheuser-Busch being part of my family. So, but currently Anheuser-Busch is no longer Anheuser-Busch. It's InBev, correct?
Thank you, Vice Chair Carlton, Michael Hillerby. Anheuser-Busch InBev, I believe, is the corporate name of the company. It is a part of a larger company now. They remain proud of their Teamster heritage and their active Teamster participation around the United States and the jobs that they help create.
We won't debate that at this moment. Thank you very much.
Okay, members? Okay, is there anyone else in Carson City? Okay, if there's anyone on Zoom, would you please turn on your camera so that I can see you and raise your hand? Okay, then broadcasting, could we please go to the telephone line?
To testify in opposition of Senate Bill 307, please press star 9 now to take your place in the queue. Caller with the last 3 digits of 729, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Madam Chair, members of the committee, for the record, my name is Katie Jacoy, Katiejacoy. I'm Western Council for Wine Institute, a public policy association representing over 1,000 California wineries and associate members. We're here this afternoon in opposition of the first reprint of Senate Bill 307. We've submitted testimony to the committee and opposed the bill because it amends the Nevada Franchise Act to add even more state-mandated terms to the private contracts between wineries and wholesalers, to the detriment of wineries and the benefit of the wholesalers. The law effectively ties wineries to their existing wholesalers and makes it virtually impossible for new wholesalers to enter the market. This state-mandated stifling of competition results in higher prices and reduced service, harming consumers. Since the franchise law was enacted, there has been significant consolidation of the wholesale tier. Now, national mega wholesalers have substantial control over the market due to the lack of alternatives. There is no longer unequal bargaining power that is rectified by state-mandated franchise protection. We do not see a public policy purpose in adding even more restrictive terms that further entrench the giant wholesalers. Section 1 requires the supplier to approve the sale of its Nevada wholesaler within 30 days after receiving notice. A wholesaler is critical to the survival and growth of the supplier's brands, and 30 days is not enough time to evaluate a new wholesaler in a large market. The supplier may need to meet with the new wholesaler and gather additional information to determine if the standards are met. The state-mandated 30-day time frame is Section 3, subsection 13 prohibits materially different payment terms for winery payments to wholesalers versus wholesaler payments to wineries. However, these are very different commercial transactions. Almost all wholesaler payments are to purchase the wine, which is a standard business transaction. In contrast, winery payments to wholesalers are typically for special promotions. The winery needs to verify reports submitted to the wholesalers, and payment delays can occur due to inadequate information from a wholesaler. To legislate against wineries for unintentional payment delays is an unfair intrusion into business practices. We do hope to continue to work and come to agreement on amended language on these two sections with the wholesalers. Thank you for the opportunity to provide testimony.
Thank you so much for your testimony. Broadcasting, next caller.
Caller with the last three digits of 216, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Thank you, Chair and committee members. This is Brian Reeder, that's B-R-I-A-N-R-E-E-D-E-R, with Ferrari Public Affairs, speaking on behalf of Molson Coors. To be brief, I'll just say that we agree with the testimony from Mr. Hillaby, and also say we value our relationships with our distributors and look forward to further work this week. Thank you.
Thank you for your testimony, Mr. Reeder. Broadcasting, next caller, please.
Caller with the last three digits of 523, please slowly state and spell your name for the record. You'll have 2 minutes and may begin.
Thank you, Madam Chair, members of the committee. My name is Tom Clark. That's T-O-M-C-L-A-R-K. Speaking today on behalf of the Distilled Spirits Council of the United States, also known as DISCUS, and I too just want to echo the opposition comments of Mr. Hillaby and the others, and we very much look forward to the continued communications with the wholesalers and others on this particular bill. Thank you, Madam Chair.
Thank you so much for your testimony. Broadcasting, next caller, please.
Chair, there are no more callers in opposition at this time.
Okay, thank you. Is there anyone here in Carson City wishing to testify in the neutral position? Okay, is there anyone on Zoom? If you would just turn your camera on so that I may see you. Okay, broadcasting, can we check the telephone line?
To testify in the neutral position on Senate Bill 307, please press *9 now to take your place in the queue. Chair, there are no more callers in neutral at this time.
Thank you. Okay, and at this time, I would like to call Mr. Alonso, if that's okay. I know there's an amendment on Nellis to SB 307, and is that do you just want Senator Goicoechea to present it?
Madam Chair, Alfredo Alonso again for the record. Yes, we had conversations with the senator about some issues that was in a previous bill dealing with wine, and we have looked at what he is attempting to do here, and we don't have a problem with it.
Okay, thank you. Senator Goicoechea?
Thank you, Madam Chair, members of the committee. I'm going to have to shove this a little bit. I thank you for hearing this amendment. I have talked to the bill sponsor as well as Mr. Alonso, and we've got three key pieces of this bill. It's really for my a couple of wineries down in southern Nevada, but it does impact wineries all across the state. I hope you can hear me all right going through this mask. But anyway, what it really does, it allows for a non-contiguous location for a winery as long as they're both licensed. So technically, they don't have to all be in the one facility as long as they are licensed. The other piece of it, it would allow for a winery to sell alcoholic beverages at that tasting room or winery as long as they were licensed by the local jurisdiction. And I know there is at least one person on Zoom that would testify that does own the Pahrump Winery down there. The third change in it, it is required that 25% of the fruit used in a wine has to be Nevada fruit. This would also require in the production of mead that at least 25% of the honey that was used would in fact be grown in the state. And the other huge change, or the biggest change, is it would go from sell at retail, served by the glass or premise, not more than, presently it's 1,000 cases. This would move it to 2,000. Their argument is because the fruit, the grapes in the state, fluctuate so much depending on the year, the frost, it doesn't give them enough stability there with 1,000 cases. They would like to move that to 2,000 cases, and that's pretty much the gist of in fact, that's what the amendment does. It does it in a couple different sections, but that's really what it is. You can have non-contiguous as long as they are, licensed as a separate location. They can be considered one winery, sell alcoholic beverages on the premises, 1,000 cases to 2,000 cases, just to give them a little more market stability. And that is the long and short of what the bill does. And again, I brought the bill. I've got most of you are familiar with Pahrump Winery down in Pahrump. If you've ever been in southern Nevada, a very nice place to build. Bill Loken. Then we've got Tim Burke has another one. We're trying to develop an industry. We have to, again, the requirements are 25% of it Nevada fruit, which in fact will develop in my area, which is agriculture, and so we can get some vineyards and some production going that way. So Mr. Alonso and Senator Loop were gracious enough to allow me to try and drag this bill on to see if we can get a little economic development going with that. I know Tim Burke is probably on Zoom and could testify a little better to it if you have any questions. Thank you.
Okay, and I think we'll hold off because we've heard this bill, Senator Gocochea, before, so I don't want to have a bill hearing on a bill that we've heard. Thank you for presenting the amendment. I'll just go to the committee to see if they have questions for you on the amendment. Committee?
Thank you so much.
Okay, well, thank you for presenting the amendment, Senator Gocochea. Mr. Alonso, would you like to give any closing remarks on Senate Bill 307 or?
Madam Chair, members of the committee, Alfredo Alonso again for the record. I just wanted to thank the committee for allowing us to present to you today. And if anyone has any questions after the fact, I'd be glad to answer any of them, and we'll continue working.
Thank you, Mr. Alonso. Okay, members, I will now close the hearing on Senate Bill 307. Okay, with that, members, we are going to come back into our work session. I inadvertently had incorrect notes and was not supposed to roll Senate Bill 245. We thought we had another bill on here, so I do apologize for that. And I want to let the bill sponsor know that I do apologize for that, Senator. Confusion on my end, but I'm going to hand it back over to our policy analyst to bring us back into work session and present Senate Bill 245.
Thank you, Madam Chair. Senate Bill 245 makes changes regarding employment. It is sponsored by Senator Lang and was heard by the committee on May 3rd. There is one proposed amendment, and there is a mock-up attached. This is to amend the bill to authorize an employee to bring a civil action against an employer for up to 2 years after the employer's failure to pay wages, compensation, or salary to an employee upon termination is required under existing law. The Labor Commissioner is prohibited from taking jurisdiction of a claim for unpaid wages upon termination during the pendency of a civil action for the same wages. Thank you.
Members, any questions on the bill or amendment before you? I'm going to go to Vice Chair Carlton.
And thank you, Madam Chair. I know this was an issue that was brought up in the hearing, and we thought we were perfectly clear. So apparently, we need to be crystal clear. So I appreciate the amendment, and as long as the amendment doesn't slow down the bill, I'm ready to make a motion. Thank you very much.
Thank you, Vice Chair. Members? Okay, seeing none, I would accept a motion.
Thank you, Madam Chair. I would move an amend and do pass on Senate Bill 245.
I have a second by Assemblymember Flores. I had a first by Vice Chair Carlton and a second by Assemblymember Flores. Is there any discussion on the motion? Okay, seeing none, all those in favor, please signify by saying aye. Aye. Opposed? Okay, will the nays please raise their hand? Okay, I have a nay from Assemblymember O'Neill, Assemblymember Kasama, Assemblymember Dickman, and Assemblymember Hardy. Motion carries. I will assign that floor statement to Assemblymember Duran. Okay, thank you. Okay, now committee members, we can move into the last. Thank you for being here, Senator, for coming back. Okay, members, now that will move us into the last agenda item for our meeting, which is public comment. While we give those listening over the internet time to call in, I am just going to quickly run through public comment housekeeping. I just want to remind everyone that public comment is a time to discuss matters that fall within the jurisdiction of Commerce and Labor. If your remarks are outside of that, I will ask you to redirect them or terminate them. We also open and close the testimony on a bill to establish a public record of it. So public comment is not intended to be a continuation of a bill hearing. We ask that members treat everyone with respect and do not comment on comments made by other members or witnesses. And we encourage you to submit your testimony in writing for inclusion in the meeting record. With that, broadcasting, do we have anyone on the phone line wishing to give public comment?
Chair, the public line is open and working, but there are no callers at this time.
Thank you so much. I appreciate that. Committee members, you should have received a revised agenda for Wednesday's meeting. Please note the start time of 1 p.m. Is there any other comments from committee members? Okay, seeing none, we are adjourned. Thank you.